A very good evening to all of those who have joined us for the beautiful session. Today we are hosting. Today's the actually this is the third session of today. So welcome you all again. Now I would like to invite Priyanka for quick introduction about Jignasa and to welcome sir. Priyanka.
Hari Om everyone. A warm welcome to the sixth session of AYUR Anatomy, a lecture series for the first year BMS student. The exclusive session will be taken up by eminent speaker of anatomy across the country for a period of 27 days. It started from 23rd June. Before starting the session, let me introduce you to the Jignasa. Jignasa is a pan-India platform for Ayush fraternity led by student community of Bharat and was initiated by ABVP in the year of 1998. Its motto is Learn Ayush to Practice Ayush. It involves empowering Ayush students from campus to community, bridging the gap between Ayush students and policymakers as well as administrative authorities, connecting every aspect of Ayush including students, academicians, practitioners, scientists, industrialists, hospital all over one umbrella. Think globally, act globally. In the last 2 decades, our efforts were to strengthen the Ayush education system and boost confidence among Ayush students. Jignasa initiated various programs in different parts of the country, from grassroots to international platform, through discussion, study circle, seminar, workshop, and conference. Let me list few initiatives undertaken by Jignasa. Study circle, lecture series on specific topic, free medical college, free medical camp, social health status survey, hands-on training workshop, conference to explore and learn unique aspect of Ayurveda, interaction with eminent academicians, brainstorming session with Ayush stalwarts, policymaker and key stakeholder of Ayush system, National Arogya Expo and international conference, national level seminar, medicinal plant visits, pharmaceutical visit, aggregation for the demands of Ayush student community, private internship programs for interested students to learn with acharyas, interaction with healers and visit to explore regional flora, online mock test, social awareness campaign on various issues, campaign for promotion of various concepts of Ayush system for social welfare. Example, Swarnabindu Prashana camp, group Surya Namaskar and yoga competition, etc. Free healthcare assistance to people through local governing bodies during natural calamities and accidents, and many more. So far, in our session, more than 1400 students joined for the live session and asked their queries regarding the question and examination, and therefore, there are 400 plus on our YouTube channel, so on. We hope to reach as many students as possible who can make maximum benefit out of it. विद्यानाम नरस्य रूपम अधिकम प्रचन्न न गुप्यते धनम. We have seen the inability of common student to afford huge amount on commercial study platform despite their jignasa, the burning desire to learn. Jignasa is here to give a helping hand, learn anatomy with expert. All we need is your immense interest to learn. Today we have Dr. Anup, Associate Professor, PG Department of Rachana Sharira, NK Japshetty Ayurvedic Medical College and PG Research Center, Bidar. Sir has completed his undergraduation in 2003 from NKJ Ayurvedic Medical College and PG Research Center, Bidar. And Sir has completed his post graduation in Rachana Sharira in 2008 from NKJ Ayurvedic Medical College and PG Center, Bidar. And Sir is pursuing PhD from RGHS Bangalore. Sir has published 29 articles in various national and international journals. He has given 5 presentations on guest speaker. Sir has attended 18 national international level seminars and 2 CMEs. He has published 1 book on Garbha Shariram, 7 video classes recorded at web-based learning program at RGPTR Jamnagar on Garbha Shariram and Kala Shariram. He has organized 2 international webinars on as organizing secretary. We welcome you to the session, sir, and to teach and everyone who is watching this. Hope you find it helpful. Thank you.
Thank
Thank you,
you,
Priyanka.
Priyanka, for giving such a wonderful introduction, and I will congratulate Dr. Jigyasa for organizing such a wonderful programs for the exam going undergraduate students. And I hope every session was I was attended previous sessions also, which was very good sessions given by the esteemed teachers of Rachana Shadri department, and I'm very much thankful for calling me to the for this session on the and topic allotted me is the related to the osteology for the exam going students, and as osteology is the biggest topic which is unable to cover in a few hours, and for that one it is a just exam oriented session, so I was prepared the slide as for the exam appearing students. So from this I will start my session. So today's topic related to the basics of osteology. So actually, osteology is the largest and widest topic in the Rachana Sharira in anatomy, which will have the number of bones. We have to learn, study everything and each and every point related to the bones. But just session is related to the exam appearance students. So what the topic has to cover and what the syllabus is related to the osteology, that I will tell you. And in today's class, today's session, we are going to learn about the introduction of the osteology, just in brief, functions of the bones, number of the bones, the classification of the bones, so bone surface markings, nothing but the terminologies related with the and bones. I'm trying to cover the maximum points related to the osteology, but as it is an exam oriented sessions, so I was given in brief about the complete osteology. So what the osteology we have to learn in our syllabus point, which was prescribed by the NCISM. So NCISM prescribed us to learn about the bone in the form of their structures, the types of the bone, the ossification of the bone, along with the description of each and every bone of the body with its clinical anatomy. This is the prescribed syllabus of the NCISM for the first phase students from the 21-22 onwards batches. So in this one, what to study in osteology perfectly, they have given in elaborate manner. So previously the syllabus was stick on this first point, that is bone structure types and ossification. But in the recent syllabus copy of your NCISM, they have given what are the points to be covered in the osteology. First point, they have given the anatomical terminologies related to the bones, the skeletal and its importance, the functions of the bones, the characteristics of the bones, and individual bones with their clinical anatomy. The fourth point in this session is unable to cover. So just I am covering the skeleton and its importance, functions related to the bones, and the characteristics of the classified bones. Okay. And also they have not only given the importance for the osteology for the theory purpose, they have also given they have also included the osteology in Viva OC and the practicals too. What the point they have covered, that is described and demonstrate the external features of the bones and the muscle with their muscle attachments. So the last point, which is observing you on the screen, that is about the practicals. They have proper importance of the bones in the Viva OC examination. They are also given their importance in the practical in the form of the your or what you can say the spotting point of view. So this is the prescribed syllabus of the NCISM in relation with the osteology. So let us begin with the introduction of the osteology. So what we learned about the osteology is that the definition includes the osteo and the logy, which means the scientific study of the bones is called as the osteology, in which the bone is the dense connective tissue which will provides a dynamic framework to our body. So here, one point I would like to cover, that the certain times the terminology related to the anatomy they may going to ask you in the objective type of the questions. For example, study of the bone is called as embryology, osteology. They may give the options like that, so you can tick on the perfect answers. So here, one more thing I would like to clear for the students, that I will tell you about the certain things which are related, how they may going to ask the question on on that particular slide itself. Okay, so the next point, What is a skeleton and how it will form? The skeleton is nothing but the bony and cartilaginous framework of the body, which will constitute the skeletal, which is of two types, that is endoskeletal and the exoskeletal. The two terminology itself will give the clear picture, endo and exo. Skeleton is the common terms. Endoskeleton nothing but the skeleton which is appeared inside inside the body, that is called as the endoskeletal. And the exo means the outward. The skeleton which is appearing outside the body is called as the exoskeleton. So what is the exoskeleton? Particularly exoskeleton we will find in the human beings, that our bones are covered under the muscles and the skin. So that's why that skeleton is the endoskeleton. Whereas the animals like tortoise and the snails, so these are the animals which have their skeleton outside the body. So those are called as that skeleton is called as the exoskeleton. In human beings also we will find a certain bones which is representing on our body in the form of the nails and the enamels of the teeth. So these are only the two anatomical structures which we can include under the heading of the exoskeleton. So here also you may get the doubts or the chances to have the multiple choice of questions. Okay. So the next, these are the biggest example. What is the endo and the tortoise is the best example to have the exoskeleton. So, what are the structural functions of the bones? As we know, it is a dense connective tissue of the human body. So, definitely it will helping us to form the framework of the human body, which will give the proper shape and the form of the body. Just you can imagine the body without the bones. It will just like a form like a ball, and we will roll instead of walking. We are rolling on the ground. So that's just like a funny. So that's why our bone that will give us a clear picture that our bone will form the framework of the human body. As it is forming the framework of the human body, it will supports and it will also help to transmit our weight of the body. So that's why it can't put a pressure on any single bone, which is transmitting from bone to bone, and like that it will transfer the bone of the body to the every bone simultaneously. Also, it will act like the levers for the muscles, and therefore we will that will help us in the movements of the human body. As locomotion is the important function of the human body, along with the locomotion of the locomotory function of the human body, we will perform the different motor functions just by your forearms, by your shaking, by your other relevant anatomical structures of the human body, and that functions are carried out with the help of the muscle itself. So, as the bones are covered with the muscles, so what are the locomotory functions are carried out by the muscles? That is because of the bones itself. So, along with that one, the bone will provide the protection to the number of viscera, for example, brain, lungs, and heart. As we all knows that brain is covered in the bony framework, which we can call the skull, whereas the lungs and heart are covered under the thoracic cage, which is again the forming the bony framework of your ribs. So that's how we can say the bone will provide the protective function. Bone will perform the protective function by protecting the number of visceral organ, example bones, lungs, and the heart. So it is also been act as the storehouse for the calcium, which is the important mineral or the mineral required for our body. Also, it will help for the from to form the formation of the blood, the called as the hemopoietic functions of the bone or the hemopoiesis function of the bone, which will help for the formation of the red bone marrow as well as the yellow bone marrows. So these are the brief functions related with the bones. So after completing the functions of the bone, we will have the throw light on the number of bones. So commonly we will have the number of 206 or 206 bones are present in the human skeleton, which widely divided in the bones of the upper limb, bones of the lower limb, skull bones, ribs, sternum, and the vertebrae. So here the number of chances are there to ask on to ask the question on the multiple choice questions, that bones number of bones in the human body, as they have given the option 206, 208, 210, like that. You have to click on the perfect answers. So simultaneously there are the chances to ask the bones numbers, like the limb bones will have the 64 in number, 62 are the bones of the lower limb, 29 bones comprising the skull, and 24 will form in the ribs or the thoracic cage, along with one sternum. So the option vertebrae is having the 33. So these are the numericals which we should keep it in our mind, because the number of chances to ask the multiple choice questions on this the number of bones. So this is the number bones which are present in the skeletal system of the human body, which is comprising the endoskeleton of the human body as skull, starting from the top to the bottom, which will have the skull, cervical vertebrae in the neck region, the clavicle, which is also forming the framework of the thoracic cage, the humor, the ribs, which and the sternum, which will forming the thoracic cage, the upper limb bones, which will have the radius, ulna, and the will have the radius, ulna, and humerus, and the carpals and the metacarpals forming the upper limb bones. Same coming to the down, which is the will have the pelvis with the help, which will form with the help of the sacrum and the coccyx and the hip bone, whereas in the lower limbs will have the femur, patella, tibia, fibula, and the metatarsals and the phalanges. The upper part of the human body will joining with the lower part of the human body with the vertebra simultaneously in the upper part, that is skull joining with the thoracic cage with the cervical vertebrae. So this is the gross framework of the human body which is forming the skeletal system. So, as the in the skeletal system in this slide we have observed the bones have the number of shapes and the number of different shapes of the human bones. So, based on that one, the bones have been classified. The number of classification have been given for the bones. Just the first classification, the bones are classified on the regional classification, that is the axial skeleton and the appendicular skeleton. The axial skeletal means the bones forming the axis of the human body, which includes total number of 80 bones forming the axial skeleton. For example, skull, ribs, sternum, and the vertebrae. These are forming the axis of the human body, which is in the form of the central axis, means on which our human body is completely standing. So that is called as the axial skeletal. Next, we'll have the appendicular skeletal, which will forming the limbs. We will have the upper limbs and the lower limbs. Like that, we will totally 126 bones, which will forming the appendicular skeletal. So this is the basic classification of the bone based on the regions. Next, this is the example that is of the this slide showing you the picture will show you, it shows you the blue part of the picture will forming the axial skeletal and the pink part of the picture will forming the appendicular skeleton. Next, we will have the axial skeletal, the skull, which will forming the totally form with the 8 cranial bones, facial 14 bones, auditory ossicles, which are present in the ears, are the 16, and the one hyoid bone. Like that, the skull will form. The vertebrae, which includes totally 26, along with the sternum and the 24 ribs on either side, which is connected with the sternum on the front, and the back side the ribs are connected with the vertebrae. So by this, the connection of the vertebrae along with the sternum and the ribs will forming the thoracic cage in the axial skeleton. So these are the parts of the bone which will forming the skull. That is the frontal bone, parietal bone, temporal bone, occipital bone, mastoid, a nasal, ethmoid, zygomatic, mandible, and lacrimals. So this slide will gives you a clear picture of the skull. That is the external skull. Internally, in the next slide, in the same slide we will have where I'm moving the cursor. There we will have the perpendicular plate of the ethmoid, the vomer, and the quadrilateral cartilages. So this will form the skull bone. So along with that one more bone will included into the axial skeleton, that is the hyoid bone. The location of this picture is very clear in the neck region. So you might have been observed the complete skull here in this slide. I think everyone will going to see the slide. So next we'll have the thoracic cage, a part of axial skeleton. Here we have counted the ribs starting from to the 1 to 10, and everyone has note 11 and 12 are the floating ribs. The ribs 11 to 12 ribs are connected with the sternum in front, and the back side they are connected with the vertebrae from the cervical and the thoracic vertebrae. So this is the in the another picture we'll find the colors of the different vertebrae. That is, pink color will show the cervical vertebrae which is present in the neck region. Next we'll have the thoracic vertebrae which are yellow in color. Bluish color will show us the lumbar vertebrae will form in the lumbar region. The sacrum and the coccyx are present in the pelvic region. So this all structure which is located, which I have shown in the previous slide in the skull, and in this slide I am showing that is the vertebrae and the thoracic ribs will form the axial skeleton. So next we will have the appendicular skeleton. Appendicular skeleton forming the upper limbs and the lower limbs. The but before the upper limb we will have the pectoral girdles which will have the clavicle and the scapula. These are the two bones which are present on either side, right and the left side. The clavicle bone which is present in front and the scapula bone which is present on the back, and it will rest on your thoracic cage. So that's why two bones of the clavicle and the two are the scapulary bones. Next we'll have the upper limb. Upper limb also right and the left are upper limb. So that's why we'll have the two humerus, two ulnus, two radius, and the carpals are the 16. Carpals will forming the 8 bones on the wrist region. They are divided into the two rows, the front rows, upper rows and the lower row. Each row will comprise the 4 carpals. So like that, the wrist bone will have the 16 carpals on either hand. Next, we'll have the metacarpals, that is forming the we can say the fingers of the five fingers forming the metacarpals, and the phalanges are the 14 metacarpals are present on the each hand. So like that, 5 fingers will form in the 5 metacarpals into 2 hands, that is forming the 10 metacarpals, and 14 phalanges, that is 14 into 2 in the hands, forming the 28 phalanges. So this will comprises the upper limb bones. Next, the lower part of the body, which will before the lower region, lower limb, we will have the connectivity with the pelvic girdle, or we can call the hip region for that one, which will comprises with the two hip bone on either side. Commonly, we can say this is the pelvic girdle or the pelvic region, which will have the number of the organs are located in this pelvic region. Differently organs are located. This pelvic region will also protect the pelvic organs. Different organs are located, either males and the females differently. That is not the part to discuss here. So coming back to the lower limb bones. So lower limb will have the how the upper limb will have the bones. Similarly, lower limb will also divided the same bones. That is two femur on either side, patella, which is connecting the what we can call the thigh region to the lower limb, or the leg region we can say here, which will forming the knee joint. So that is the two patellas, fibula and the tibias on either side. Next we will have the how the tarsals, carpals are there. Similarly here we will have the tarsals. Instead of the carpals, we will have the tarsals, and similarly we will have the metatarsals and the phalanges here. So tarsal will form the 14, metatarsals are forming the 10, and the phalanges forming the 28. So was back when we calculate all the bones here, this is forming the 126 bones of the appendicular skeleton. So appendicular skeletal bones and axial skeletal bones commonly will have the 206 bones of the human body. So this picture will give the clear, this slide will give the clear cut pictures of the upper limb bone. Those are the phalanges. Here I was marked. The metacarpals we have marked here, and the carpals. Okay, and the same picture we have, this carpals will form in the wrist, and of metacarpals and phalanges will forming the hand. So here below the carpals we have marked here in the diagram, that is the radius and the ulna bone, which are the bones of the hand. About the bones with a hand, we will have the arm region, which we will call the humerus. So before that, one should know the humerus region, bone region, which humerus bone, which it will falling. That part of the forearm is called as the arm. Below the arm, we will have the shoulder joint. Below the shoulder joint, the region where we will have the ulna and the radius. This region is called as the forearm region. Below the forearm, we'll have the wrist joint, and below that, we'll have the hand. So this is the anatomical division of the upper limb, that is the arm, forearm, wrist, and the hand. Similarly, we will have the lower limb, that is the pelvic region, which will form the pelvic bones, that is the two hip and the we can call the we have the sacrum and the coccyx in the form of the vertebra, and this region will have called the pelvic region. So where the two hip bone will connect it to each other, though that region is demarcated as the pubic symphysis. So next, where the femur will connect it with the hip bone is the hip joint, which will form the thigh region of the lower limb. Next, we will have the in between the thigh and the leg, we will have the connection of the knee joint, and that there we will have the one more bone, that is the patella, or we can call it as the kneecap. Whereas the lower limb leg will have the two bones, that is the tibia and the fibula. Coming to the next picture on the same slide, we will have the tarsals, that is the calcaneus, talus, and we will have the three cuneiform bones, that is the medial, lateral, and the intermediate cuneiform. Medial cuneiform, intermediate cuneiform, lateral cuneiform here. Next, we will have the cuboid. So this complete structure will form the which we can call the ankle region. Also, we can call to this particular area. Next, we will have the metatarsals. Next, will the proximal phalanges and the middle phalanges and the distal phalanges. So this complete region is called as the foot. Okay. So by this, we will have the lower limb division as the pelvic, the thigh region, the knee joint, the leg region, the what we can call the ankle region, and the foot, comprising the complete all this structure comprising the lower limb. So this is about the classification of the bones as on the regional basis. So the next we have found the bones on this particular slide have the different structures, different shapes. Either in the lower limb we have found the same bones of the different structure, as well as in this slide we also found the different shape of the bones in this both the slides. Okay, so based on this structural class, this one, what we have observed that bones has divided on the morphological basis. What is the morphological base for the classification? Then according to the shape, the bones have been classified. That is long bones, short bones, short long bones, short bones, flat bones, irregular bones, pneumatic bone, and one is the sesamoid bone. So seven classific structure, seven classification in seven groups. They have been classified based on the morphology, or we can call based on their shape. They have been classified in these categories. So we'll see one by one. What is a long bone? How we can differentiate the long bone? So the name itself indicate the long. Long means the in their length. So having the length than the width, such bones in the human body are called as the long bones. So as the bone has been long in their length, so that's why they have the three. They are divided into the three different parts. That is the upper end, the shaft, and the lower end. So this is the common structure which we'll find in the long bones. The example of the long bones in the skeletal system is the femur, tibia, fibula, humerus, radius, and the ulnas are the best examples for the long bones. Next classification we will have short long bones. They have also same structure, that is length is larger than that their width, but as they are short in their length as compared to the long bones. Long bones have the long length, but these short long bones have the length is longer but width is smaller, but length is smaller than that of an long bones. The examples are metacarpals, metatarsals, and the phalanges. The slide is very clear for this one, that which will give the clear picture of the bones, that why they are classified under the heading of the short long bones. Next, these are the that is the small polyhedral bones having the equal length and the equal breadth, which will provide this particular structure provides the strength and the compactness to the bones, which is heading the third classification include the short bones. Here we have found the length and the breadth is equal. Examples for such bones is the carpals and the tarsal bones, which will forming the wrist joint in the upper arm, upper limb, and the ankle region in the lower limbs. So the bones in these particular regions are included under the heading of the short bones. Next, we will have the flat bones. The best example for that one will get the scapula, which will have the expanded and a plate-like appearance. So why this bone have the proper this type of structure? That this type of structure will help us to protect the vital structure. As I was told in the previous slide only, scapula is the bone which is present on your back of the which resting on the ribs. So that's why it will protecting the ribs. Also, it will protecting the lungs on lungs which are located inside the thoracic cage. Best example for such type of bones is the scapula, ribs, sternum, frontal bone, parietal bone, and other bones related to the which have the commonest plate-like appearance. This bone, why this bone have the plate-like appearance and why this have the expanded part? Because of this structure, they will provide the extensive area for the muscular attachment. So the next we will have the irregular bones. The name itself indicate irregular in their shape, isn't it? Why? Because we are studying all this classification under the heading of the morphological classification, or we can say the bones have been classified based on their shape. Now we will have the irregular bones. This indicate the bones which will have the irregular in their shape, irregular in their outline. They are situated in such a places where where our body needs more strength. So vertebra, which is forming the in central axis of the human body, which needs our complete body is dependent on our vertebrae. So that's how we can call those bones as the backbones, which are very protective and protective function. That's why we are saying that these bones will give the maximum strength to the human body. And also these are located where the more compactness is needed. Means based on the location they have acquired their shape, and that's why they have been called as the irregular bones. Examples are the vertebrae and some skull bones also included under the heading of this irregular bones. Next classification is the pneumatic bones. Why do you called as the pneumatic bones? These are also flat and irregular bones. Common we can say the composition of the flat and irregular bones will have the pneumatic bones. Flat and irregular bones which will present as the hollow space within their body, which will consist the air. So that's why they have been called as the pneumatic. Okay, so examples for that one is the ethmoid bone, sphenoid bone, and the maxilla, which are comprising the skull bones, where we need the space to pass the as this forming the sinuses, or the area is required, the airspace area is required in our skull. There they have been located. So these are called as the pneumatic bones. Next, we will have the sesamoid bones. Just the appearance, sesamoid, the name itself indicate the seed-like appearance. Sesame is the one part, one kind of seed. Everyone knows that one. The shape of the bone resembles like the sesamum. So that's why the name has been given, the seed-like appearance. The nodules of these bones will help which develop in the certain tendons. In this diagram, I was showing you the knee joint where my cursor is moving. So this is the location of the patella. Okay, where this is that long thread-like appearance which is coming from upper side and also from the lower side. These are nothing but the tendons of the different muscles which are running in the thigh region and which are running into the leg region. So certain nodules of these bones will forming with the help of the tendons which are inserting the muscles, the tendons of such a muscles which are inserting in this particular bone. Example are the patella and the pisiform bone. These are the best example for the sesamoid bones. So this will complete our classification of the bones based on the shape or the morphological classification. Next, we'll have the classification of the bones, which is the third type of classification. Remember, once again, I'm revising you. First classification is the axial and the appendicular. Next classification we have studied on the shape. Third classification we are studying on the gross structure. So the bones have been classified into the two categories as the compact bones and the spongy bones. So the name indicates the compact itself. The compactness means the where the bones are connected very tightly. So the dense appearance of the bones. So such bones which are the densely arranged, such bones, suppose for example, keep it in the mind where the bones are connected tightly, definitely as already we have studied, the bone is the hardest structure. So commonly where the again two bones are connected with each other, that's why the bone will forming the hard structure. Bone is the hard and the dense, and it's a very less porous. Here the compact bone, we don't have any type of the spaces. Okay, for example, shaft of the long bones are the example which is forming the compact bones. The spongy bones, the name itself indicates sponge-like appearance, means inner part of the bones which will have the pores inside that one, and that's why the inner part of the bone which is very less hard and present the what we can porous appearance, which will consist the which will give the space for the red and the yellow marrows. We will have the upper part, lower end and the upper end of the long bones also included in the part of the spongy bones. Flat, short and the irregular bones are also included under the heading of the spongy bones. So structurally the bones have gross structurally the bones have been classified under the heading of this compact and the spongy bones. Here in this slide we can see very correctly compact bone, the outer lines we can see on the slides, that the bone structures are arranged very compactly, means we are not get any space in this region. So this will forming the compact structure. So that's why this bones called as the compact bones. And inner to that one will have the spongy appearance, small spaces we are seeing under the this type of the bones, and these are forming the spongy bones. Next, what is the typical? So this will complete your classification of the bones. So the next, commonly the common typical bone structure, how it is. So one I was told in the first introduction only, we are unable to complete individual bones. So that's why grossly I am telling you the gross structure of the typical bone, what it will house. So the articulars, the bones, commonly the long bone have the longer strength than that of a shorter width. So that's why they have classified as the upper end, middle shaft, and the lower end. So and the articular cartilages. They consider it will consider the hyaline cartilage covering the end of the bones. So the vertical, so the horizontal diagram which I have kept in the bottom of the slides, we can see here. This is the upper end, these are the one end, this is the another end, and middle to that one the longest part will the shaft, upper end, lower end, and the shaft we can say here. So in the upper and the lower end, these are the two ends which have the connection with the another bones, or we can say the joint will forming when the another bone will connect with the upper part and the lower part. So that's why these both the parts need the cartilages to get the connection with the another bone with, and this will form the joint here. So for example here the tibia, fibula, femur, humerus, scapula, the bones which are forming the joint. For example, I will give you here that humerus is the bone we can take here. So the humerus is the bone which will connect upper side with the scapula to form the shoulder joint, and at the lower end it will connect with the radius and the ulna to form the elbow joint. So both the ends of this bone will have forming the joint. So that needs the articular cartilage. So that's why the two ends of the bone will have the articular cartilage. Coming to the epiphysis and epiphyseal line, the end of the bone, one at the end of the long bone, the two ends of the bones are called as the epiphysis, which are termed previously as the upper end and the lower end. These are called the epiphysis. Epiphyseal line, remnant of the cartilaginous. During the growth of the human bones, the remnant will remains as the cartilaginous structure. Bone is the cartilaginous structure. So during the development of the bones, the cartilage will form, osteophyte will form, and that will small cartilage will remain. So during the growth, as we know, human body is the routinely or running the growing process that is the common physiological tendency of the human body. So that's why in children's bones are very small bones, and when you attain the adult, the length of the bone at the height of the human body will increasing, the length of the bone will also increases. So that's why to enhance the length of the bone, we will have the upper and the lower ends, both the ends are growing ends of the human body. So that's why we need here growth plate, and that's why these are called as the growth plates or epiphyseal plates, through which the bone will start to increase its length, and like that human length will also, height may also starts to increase. So these two growth plates or the epiphyseal plates are present at the two ends. And next we'll have the middle longest part of the bone, which will called as the diaphysis, and commonly we can call this part as the shaft of the bone, which will consist the thick collar and a compact structure. So as previously I was told you the classification of the bones, that is the compact and the spongy bones. So the middle part of the bone, which will form in the shaft, this is the compact structure, and that's why this is called the compact bones. Whereas both the upper and the lower ends will giving the appearance like the sponge-like appearance because of the presence of porosity inside this bones. So that's why this is called as, these are nothing but the spongy bones. And also we have studied one more function of the bones. You can remember that is the hemopiosis, that is the formation of the red bone marrows, and the storing of the yellow bone marrows. So this function is carried out in this upper end part of the bones, and because of the presence of the porosity inside the bones, these bones are able to perform that function. So this is the gross structure of the typical long bones. Okay, so the next slide I want to show you that is the what are the types of the bones. As in the previous slide I was told, the bones is the continuous growth is needed for our body, and ossification is a continuous process of the human bones. So what the bones will for how the bone will form with the which type of the cells. So the bone is formed and metabolized by the particular specific cells, and those cells are called as the osteoclasts and the osteoblast. Here the two terms we will remember, keep it in mind, C and the B. Osteo refer the bones, clast refer the cells. So inside these two words, we will have the C is the common word, which means the chewing. That is destruction. Chewing means, see, when you put any food bolus in your mouth, what the function of the teeth is the chewing. So we are destructing the food particles here. So here the C is the word we give in the meaning the chewing, which means the routinely once the bone will grow, it will stops its growth, and it will remains as it is, and later on what the normal physiology of the human body will say is the destruction or the degeneration. In medical language we can call the degeneration. What the degenerate, the bone will starts to degenerate when we will attain a certain age. So how the degeneration will occur here by the process of chewing, means the osteoclasts are the bone which are helping to chew the bones. Chewing means the to degenerate. Okay, so that's why the osteoclasts are the such bones which will help, which are forming the degeneration of the human body. So that's why these are called as the destructing cells or the bone destroying cells. Next type of the cells we will have the bone. See, one cells are destroying, and another bone is the building. So which is the another bone? That is the osteoblast. So this term will have the word that is the B. During the pronunciation only we will have the blast. Blast is nothing. B means the building. The cells which are helping to build the bones, those cells are called as the osteoblast. The bones which are helping to degenerate the bones, those cells are called as the osteoclast. So these are the two types of the important cell. One cell will help to degenerate, another cell will help to build. So in between the two cells, one more cell will have the osteocytes, which is called the matured bone cells, which have the spider shape and which will maintain the bony tissues, which will maintain the proper bone in its proper tissue form. So these are the three type of the bone cells. In this is also the type this part of the your osteology may have the chances to ask even the multiple choice question. The cells of the bones are called. They will give the options. So you can click on the or you can write out the proper option. If you give the osteoclast, it is also correct answer. If you will have the osteoblast, it is also a correct answer. If they have the put the osteocyte in your options, that will be also correct answer. I was forgotten to tell you one more point in the previous slides. That is there will be the chances to ask even the question, large question, that is the classification of the bones, because your pattern will have the LAQs, SAQs, and the multiple choice. I was not spoken on the LAQs and the SAQs. What it means, I think your previous teachers have told about the SAQs and the LAQs, long answer questions and a short answer question. So there will be the chances to ask the classification of the bones in the LA short answers, SAQs, 5 marks question in the SAQs. So there will be the chances to ask this type of the question that is on the classification of the bones under the heading of the SAQs. So be perfect on that one. Again, one more there will be the chances to ask you the short question, that is the this one structure of the typical bones, that is the gross structure. There will be the chances to ask you in this also. Okay, so next we'll discuss about the surface markings or the terminologies related with the bones. I was kept here the heading as the bone surface markings, but instead of that, and if you keep it in your mind, the terms related to the bones. So here in this, what we'll discuss from this onwards is the terminologies. So keep it in your mind. This is the perfect questions, or the maximum chances to ask these questions in your MCQs. So head, what the structure of the bone is called as the head, or how it will looks. So the head is the large round structure which is present on every long bone. It is the projected part which will support the neck, which is the one more constricted part. How our human body structure is there. The neck is the part which will connect to the head or the upper part with the another part, rest of your body. Similar way, the neck in this diagram, it's clear. The white part of the bone is called the head, and constricted part of this part is this bone is called as the neck region. So this neck will help to connect the head to the under to rest of the bone. So this rounded part of the each bone is called as the head, and commonly head we will get in the humerus and the femur. And commonly will have the radius, ulna, tibia, fibula. All the long bones will have the head. Is the rounded part of the bone. Next term is the condyle, the large round protuberance. Again, one more doubt here arises. Protuberance. What we mean by protuberance? The elevated part or the protuberant part of the bone is called as the protuberance. The condyles are nothing but the large round protuberance with smooth articular cartilages at the end of the bones. So here we will have the epicondyles or the condyles. Medial and the lateral epicondyles of the femur very clearly is available in this picture. That is the epicondyles, commonly called the condyles, are also femur in the bone. We can call the epicondyles, medial epicondyle and the lateral epicondyle, which are the protuberance, mean the which will give the wide part of the lower end. So this is the upper end, this is the lower end. So upper end will have the head, lower end will have the epicondyles, middle epicondyles and the lateral epicondyles. So this is about the head and the condyles. Next terms we'll commonly find that is the facets. So what is the facet here? The part of the bone which will give the space for the attachment to the another bones or any other relevant structure to that particular bones. So here smooth flat, the term itself indicate where I was used the word that is attachment. Where will get in the attachment? Where will have the flat area. Either it may be the concave in shape or it may be the convex in shape. That's why smooth, flat, either concave and convex in convex articular part of the bone is called as the facets. Commonly, facets are available in the vertebrae. As we have studied, vertebrae forming the axial skeletal or the vertebral column, and they are connected very compactly, very connected, very nearer to densely connected or nearer connected with each other. So they need attachment with the vertebrae with one another. So definitely they have the facets for the easy connection with the each other. Understood about the head, condyle, and the facets. Next will have the what the rounded elevations of the bones are called. All the rounded elevations are have termed in the different bones in by the different names. The rounded elevated part of the bones, they are named in the different bones with the different names. If the rounded part is present in the humerus, then it is called as the tubercle. A small red raised eminence raised part, this is the part, this is called the greater tubercle of the humerus. Similarly, we'll have the tuberosities, large rounded elevation. If the elevation is there, then that is called as the, here in this picture we'll have the this is the what you can call the condyles or the tuberosities. This is the tuberosities, radial, sorry, tibial tuberosity we'll getting here in this picture. See here, it is the elevated part of the bone. This is called the tibial tuberosity. It is also round in shape, but it is present in the tibia bone. That's why it is called the tibial tuberosity. Next will the trochanter, greater trochanter, the large blunt elevation. Here, I think I don't have the picture of this one. So we can observe in the this we can see in the femur bone, that is the greater trochanter of the femur, which is a large blunt elevation present on the femur. Then we'll have the malleolus, that is hammer shaped head shaped bony prominence, which is present in the fibula bone, lateral malleolus. So this is the fibula, this is the lateral malleolus. In the lower part, we'll have the elevated part or with the part which is coming out from the bone, expanded part of the lower side is called the malleolus. Hammer-like projection of the lower part of the bone is called as the malleolus, present in the fibula bone of the lower limb. Next, we will have the epicondyles, crust, and the spinous processes. Epicondyles, the eminence of the superior to the condyles. So here, if middle and the lateral epicondyles of the femur. So here in this picture we'll have the epicondyles which are present and the which is present in the lower end of the bones. This is the condyle, the whitest part which are where cursor is moving called as the condyles. That is the eminence superior to the condyles. Eminence which is present superior to the condyles. This is the condyle. This is the epicondyle. The eminence which is or elevated part or projected part which is located just above the condyles is called as the epicondyle, which commonly found in the lower end of the femur. Okay, so the next we'll have the crust, prominent ridge or elongated projection. So in this picture we'll have the iliac crust, prominent ridge or elongated projection, the projected part of the bone which is longer or which is elongated or which is very prominent, or when we'll touch to this part it will use the rough appearance. So this part is called as the crust. Best example we will find into the hip bone and named it as the iliac crust. So next we'll have the process, spinous process. Process is the sharp, slender projection. So this will call the spinous, the nose-like appearance of the vertebrae. It is present in maximum of the vertebrae. That is called as the spinous process. The sharp projection which is coming out from the bone and it is coming out towards outside to the bone, and this is called as the spinous process, which is present in all the vertebrae. So these are the common set terms which will be going to ask you in the objective questions. So the next, what are the openings to be turned into the bones? If the opening is present into the bones or hole like appearance into the bone, then that is called as the foramen. It is called as the foramen here. Uh, this is the this opening is called as the foramen, which is called as the obturator foramen, the largest opening in the hip bone. It's called as the obturator foramen, through which we'll have the passage of the different structure. This foramen will give the space to pass, or this opening will give the space for the passing the either blood vessels or the nerves which are supplying to the respective bones. So this is the role of the foramen or the openings. Next we will have the meatus, tubular opening, which is commonly we will see into the ear. One of our teacher recently we have discussed about the ear. I think in previous classes we have seen that is external acoustic meatus, which is present in the temporal bone. Temporal bone is the bone of the skull region, which I have shown in the previous slides. So this will have the acoustic tubular like opening into the ear. That is that opening is called as the meatus. Next we will have the fissure, that is the narrow slit like opening through the bone here into the superior orbital fissure, the two orbits on the either side of your nose where the cursor is moving on my slide. That black color will show the narrow slit like opening. This is called as the fissure, orbital fissure in, and this bone is called, where my cursor is moving, this is the sphenoid bone. The slit like opening, narrow slit like opening is present into this bone is called as the fissure, which is present into your orbits. So this is the foramen, meatus and the fissure. Commonly these are the openings into the bones. So if the for why they have been named separately, as I was told you, these are the opening itself, but the openings when it is present in the long bone or the hip bone, then the hip-like bone or the long bones or the upper limb, lower limb bone, that is called the foramen. If the opening is present in your temporal bone, then that is called the meatus. If the opening is present in your orbit, then that is called the fissure. Commonly, all are the openings into the bones, but they are named dependent on their location, where they have been located in the particular bones. Next term is called as the depressions, or the what you can call the depressed areas of the bones, the notches, indentation at the edges of the bones, greater sciatic notch. Coming to the previous slide itself, this part which is crossed or the angular part of the hip bone where my cursor is moving, this is called as the notch. Can observe in this diagram, that is the notch, that is the indentation at the edge of the bone. This is called, this is the indentation at the edge, at the end part of the bone, which is termed as the notch, and the name has been given to this notch as the greater sciatic notch. Why? Because the longest nerve of the human body, sciatic nerve, is passing through this greater sciatic notch towards the upper part of the body. So that's why the name has been given to this notch, the greater sciatic notch. Next depression is called as the sulcus or the groove. The elongated depression or furrow along with the bony surface. The phony surface, this is the intertubercular groove. Can see intertubercular, the groove is there or the depressed area is present in between the two tubercles, greater tubercle and the lesser tubercle. This is the diagram of the humerus bone which is present in their upper limb, and these tubercles are present in the head of the humerus, as humerus is the longest bone. So this bone will also head, shaft and the lower end. So in the head itself, the circular part, the tubercles are present. One is the large, that's why it is called the greater, Another one is the small, that is the lesser tubercle. So in between the two tubercles, we will have the elongated depression, and that is called as the groove. Commonly, we will have the bicipital groove of the humerus. Why bicipital groove? This has been termed because if you dissect the human, as we are known, the bone will give the provide the attachment for the bones muscles. So our biceps bone will insert with the two heads in this bicipital groove. So that's why it is called as the bicipital groove itself, and this elongated depressed part is called as the groove or the sulcus. Next we'll have the fossa, shallow depressed part. Again we will find it into the lower end of the humerus itself. Okay, so this the depress means if you put your index finger into this shallow depressed area, it will fit into that particular fossa or particular depression. So this depressed part of the lower end of the humerus is called as the fossa, olecranon fossa of the humerus. So this is called as the fossa. All the three definition, notch or sulcus or the groove and the fossa, these are called as the depressions, but based on their location they have been named. If it is located in the hip bone, then it is called as the notch. If it is located in between the tubercles of the humerus, then it is called as sulcus or the groove. If it is located shallow depression or the large depressed area in the lower end of the humerus, then that is called as the fossa. So this is about the definitions or the common set terms which are learned, which are commonly find out during the study of the osteology. And I was tried to complete the terminologies related to the bones, and these are the areas where we'll get the multiple choice questions. Commonly, for example, the depressed area present into the hip bone is notch, sulcus, groove, or the fossa. The right option, you have to write it down. Similarly, the groove present in the humerus bone is notch, fossa, sulcus, or the groove. The right option may be the groove. So that, like that, they may have the questions on the foramina, meatus, fissure, epicondyle, crust, spinous process, tubercle, tuberosities, trochanter, and the malleolus. So these are the uh, area of the osteology where we'll have the number of chances to ask in the MCQs. Okay, so just I will quick review what we have studied here: the bones, the definition of the bone, classification of the bones. Sorry, the definition of the bones we have studied. Next, we have studied the skeletal, endo and axial skeletal. We have also studied the number of the bones, regional numbers, gross numbers 206, regional numbers, skull bones, upper limb bones, lower limb bones, like that we have studied. Next, we have studied the classification as the regional classification, that is the axial, appendicular, morphological classification, long bones, short bones, sesamoid bones, irregular bones. Based on the shape, they have been classified, and the classified classification based on the gross structure, that is the compact and spongy bones. And lastly, we have discussed about the surface markings or the terminologies related to the osteology. So this by this I will conclude my the today's lecture. But before concluding my lecture, as this is the exam oriented, just I want to give the certain tips to your to get you successful in your examination. That is, first you have to believe on yourself. You should be great organized for yourself during the studies. And third point, very which is very important, manage your time. I'm in the class, I was always to tell about my students that studying for whole year is different, and writing in 3 hours in your exams is different. So that's why manage your time, which is very important to get in a success in your exam. Fourth step is very important: during the study you should study very smartly. Next is the exam taking strategies. You should prepare your exams by following these steps. Definitely will get in a success in your exams. Then why? How do you study in your exams? So Begin your studies approximately 30 to 60 minutes after your meals. Never study while lying on the bed, which is common thing to know about this one. Make the list of you what you need to study. So before the class, just I was given you the first slide of my today's class, the content of the today's session. So like that, you should have prepare your protocol what I want to study in this particular hour. So that also make sure that you should make the list of that one, not to study more than the 60 minutes, because the class is also very bore when you have the more than 1 hour, which is I know that one has crossed the 1 hour, but it is the last coming to the end. Next, take a break between your studies and don't leave your daily habits during the studies also. So before the exam, in your exam hall, before giving your paper, handovering paper to your invigilators, what you have to check out? Checking out before completing your exam, re-attempt all your questions before giving the answer booklets to your exams. Check your answers. Never leave the exams early, which is our commonest habits to all of us. Make sure, because as you are appearing first time university examination, so you should make sure that your name, your number should be perfectly written in your answer booklets, and concentrate on your time hours. So summary of all the today's session is, study is an important component to prepare for your final examination. Any sort of study is inherently stressful, but there is ways to manage it to reduce your stress. Don't be stressed or don't be panic in your exam before preparing your exams. And your approach to study will very important to study what you are studying in the next hours. And the key is to effective studying is all about is the planning. You should be planning your exam before going to be your exam, which is a very good idea to start that process. Just I will study from now onward. So that's why if you are having any questions, drop in your question box. So organizers, by this I will conclude my the today's session. Thank you for giving me an opportunity for the to
Mm.
discuss all the points related to the exam with the students. Thank you once again to the
Thank you,
organizers.
sir. Sir, thank you so much, sir. We will take questions, sir. Shall we
Okay,
take, sir? Yeah.
definitely.
So the first question is, what if they ask in Ayurvedic terminology? Can they ask like that, sir?
So as there is no, there is this, our acharyas to only have the, does not have the particular Ayurvedic terminologies, as our acharyas have divided shadangas like that. Angas, Koshtangas, Kalas. Paribhasha is the biggest terminology which is used in our Ayurvedic Shastra, like Purshas and Kandaras. This is the Ayurvedic terminologies in our under the heading of the Paribhashas. Okay. Yes. Next
Can
question.
sir, the next question is, can one bone can be asked for 10 marks?
Yes, because I'm coming to the next slide. Just I will have one more slide for you papers. Just what is the RGHS question paper pattern and how the we have to plan out what type of the questions we going to on your osteology. That will be the my next slide only. So definitely there are the certain long questions. For example, scapula, femur, humerus, and best is the hip bone. Such type of the bones may going to ask in the 10 marks questions. Uh, Chances is there to get asked in the 10 marks questions. Yes.
Sir, the next question is there any difference between neurocranium and skull cap?
Actually, it is neurocranium and the skull cap. Neurocranium is the term used commonly for the vertebral column, because spinal cord is covered under the uh, vertebral column. But certain books they have mentioned neurocranium and the skull are the one and the same entities, because spinal cord is also part of the brain itself. So the neurocranium and the skull are the one and the same. Yes, next one.
What are the main contents for LAQs? Should we explain clinical aspects, sir?
It's dependent on the number of marks, how many marks the question has been asked. Depend on that one, you can add on the contents. For example, if the question is for the 10 marks of a, as the previous question was there, any bone can ask for the 10 marks. Yes, definitely the bone has been asked for the 10 marks. For example, if scapula is asked, there you should clearly write it down. First, you should draw the diagram. Second, you go with the side determination of the any bone. Third, you should write it down. Second, you should have the location of the bone. Third, you should have the side determination of the bone. Fourth, you should have the gross structure. For example, their borders, their surfaces. Okay, their ends, upper end, lower end, and the upper end, shaft, and the lower end. But like that, you should write it down. Upper end, proper explanation of the upper end. For example, if there is humerus, condyles, you should write it about the condyles, grooves, neck, and all those regions. If you next you'll go for the shaft, there you should go the borders and surfaces. In the lower end, similarly, and there you should mention the clinical anatomy. But if the question is asked for the 5 marks, there is no requirement to write down the clinical aspect. If the bone has for the 5 marks question, again the compulsion is about it to draw the diagram. Second, to write it down its answer side determination, and the third importance is given for the gross anatomical structure in form of the surfaces and the borders. That's it. No need of the write down the clinical aspect if the bone has for the 5 marks. Okay.
Sir, the next question is, can you explain ossification if asked for 5 marks? Means how to write if ossification asked for 5 marks.
Okay, okay. If they can't ask, I think so. They will not ask directly on the question that right on the ossification of the humerus like that, because ossification is the very shortest part to which will not mean for the 5 marks. If it asked, if you knows, if for example, if the bone humerus is asked for the 5 marks, and if you know about that one, you can write it down. If you leave it, there is no question for that one. Yes.
Sir, the next doubt is regarding aversion system. The student is asking, can you tell it about in brief? Aversion system.
Okay, I was not at all asked to get it into the because Haversians in today's lecture I was not at all covered with this Haversian system, Haversian canal, because it is a part of your developmental anatomy. Where when we study the bones development, just I was given the example one classification was studied Marfa, that is the compact bone and the spongy bone. There we will have when we will study the compact bone, they will have the during the development of the bone when the laminates means when the osteocytes will fit on one another and the plate like structure they will form, they will that is called as the laminas, and in between the two laminas one canal will run, and that canal is called as the Haversian canal, and that system is called as the Haversian system. But as the part big osteology, as I was told, the osteology is the biggest part, so I can't cover everything in the one class. So the next one.
Should we add the muscle attachments for LAQ or SAQ? Is the next question, sir.
For the LAQs, there is no need to add on the muscle attachment, but if you know, just you should write down the name of the muscles. And for the SAQs also, if you know perfectly, then you can add on. Next one.
Sir, the next question is, should we remember the ossification of each bone?
Just you should go through the ones. Just you should remember the ossification center and at which age which will go bone will going to ossify. That is needed for the UG students, as per my view.
Sir, the next question is, how is ulna homologous to fibula?
Actually, Allah, what we have studied that one upper limb, the arm bones, that is the radius and the ulna. Yes, ulna is homologous to the fibula. How it is means because anatomically they are located in one place. How the bone radius and ulna are present in the upper limb or the arm, forearm. Sorry. Similarly, the fibula and the tibia are located in the leg. Based on the location, they have been called as the homologous bone with each other. But structurally, both the bones are different from each other.
Sir, the
Yes,
next
next one.
question is, for each bone, sir, the next question is, for each bone, how many muscle attachments we need to write? Maximum. Means she's asking how many writes we have to write for each
Uh,
one. Good.
Okay, that's dependent on how many muscles you should remember. Based on that only you can write it down. I can't say perfectly one or two muscles. Okay, because number of bones have the different number of muscle attachment in that one. How many you should remember? How you are able to remember? Maximum you try to remember the muscle attachment related to the bones. That much you can write it down. No need to. I can't say the perfect number. How much? Okay.
I think that's the end of the list of questions we have got, sir.
Just okay. Next one, just 2 minutes, organizer. I will go through the next slide. Okay, can I?
Okay, sir. Yes, sir. Yes, sir. It's perfectly all right.
Okay, thank you. Uh, so the next is the this one. Next important parts of your exam, that is the question paper pattern related to the multiple choice questions. This is the question and the short SAQs and the LAQs. And related to osteology, we'll have the MCQs, we'll have the SAQs, and we'll have the SAQs. And NCSM is given the 16 marks for the osteology, in which we'll have the MCQs also be there, LAQs also be there, and SAQs will be there. And as the blueprint has been provided by the even NCISM itself, so as they have given one MCQ from the osteology, again the osteology and asti sharira, both they included for the 16 marks. So MCQ from one MCQ from the from the Astisharan and osteology, one SAQs, one SAQ and one LAQ. So like this, we'll have the 16 marks. They have allotted us 16 marks for the question paper, and that's it for my today's presentation. And thank you one and all once again for the organizers, and best of luck for all the students, exam appearing students. Thank you.
Thank you very much, sir. It was really great hearing to you, solving everyone's doubts, and especially letting them know yeah, there will be a question from each LAQ, SAQ, and MCQ for their final exam. Osteology is a very vast topic, sir. Even we struggled.
Yes,
We used to buy bone sets and we used to read by that and all.
yes,
So
definitely.
osteology is really a very huge topic, sir. We struggled a
Yes.
lot, and I think this batch is very fortunate because they're able to listen to teachers like you, and they're gaining something
You.
from that.
Thank you
Yes,
once
sir.
again. So that's why I was thank you to the organizers, and I hope you may arrange in future also such a great lectures. And I'm very happy to join you in the future also. Thank you.
Yes, thank you, sir. I think we all together will plan for an offline. Like we, lot of people are doing conferences, sir. I think on anatomy, like nobody is stressing. Actually, it's a huge
Yes.
subject, and it's a base
Ah,
for every other subjects. But there's no conferences or seminars happening on anatomy, sir. Everyone are
yes.
focused on like third year and fourth year
Clinical
subjects.
people. Yes,
So
clinically we
we
are
all.
focusing, but we are forgetting
Yes,
about the
sir.
base.
Basics, sir. Yes, sir, exactly. So we all together will plan for an offline event, sir. If it's fortunate, we will all meet and plan, sir. We'll make a
Definitely,
big event,
definitely,
sir. Yes, sir.
definitely.
Thank you, sir. And
Thank you.
behind this whole AYUR anatomy session, sir, our team is working tirelessly, sir. They are working day and night despite their classes.
Yes,
They are also third year and second year students. So
The
they are
your
also
organization is
working.
very good, and I will wish all the best for the organizers, and I will congratulate all the team of Jigyasa.
Thank you so much, sir. Whatever this program is happening today, all credit goes to my team, sir. And they are doing the posters, collecting CV from teachers, getting them updates, and organizing juniors, sending them links, sharing on status and stories, everything.
Yes, it
So
is the
everything
biggest
is
task.
coordinated, and they're giving their time despite their own academic schedule. So we are working something. We wanted to do something for our juniors. So we
Definitely,
struggled
once.
during our anatomy, preparing for anatomy classes, and many of our batchmates had backlogs in anatomy because they didn't know how to approach the answers in the subject. Though they know the content, they had the knowledge of the what is there in the subject, they didn't know how to present. So we thought of that should not happen for juniors, given their new pattern of exam. So we planned and came up with this idea. And
Yes,
today
very good.
we have listed 6 sessions, sir. This is the 6 sessions, and I'm
I will
more than
appreciate
happy.
your
And all of us are more than happy that it's going in a good direction. Our videos are getting more than 1K plays, and more than 200 300 students are joining during our live sessions today. This is the third session, and the enthusiasm of all the students has been the same. So really thank you so much, sir. Really big thanks to
thank
you
you.
for joining us. And and also there were technical glitches. Despite that, you have joined us and given your time, your precious time. Really thank you for that, sir.
Thank you and congratulations. Okay, thank you, better.
Thank you, sir. Yes, sir. Thank you, sir.
Thank you.
I think we can end the session now, sir.
Okay, no problem. Thank you.
Thank you, sir.
Student.